disorders are defined in terms of emotional, cognitive, behavioral, and somatic symptoms. In addition to a feeling of pervasive despair or gloom, people experiencing an episode of major depression are likely to show a variety of symptoms such as diminished interest in normal activities, changes in appetite and sleep, fatigue, and problems in concentration. So, people with depressive disorders grapple with depression only, and it is called unipolar depression. People with bipolar disorder contend from both depression and mania. A person in a manic episode feels elated and energetic. Manic patients also exhibit related symptoms such as inflated self-esteem, rapid speech, and poor judgment. So in bipolar disorder, episodes of mania alternate or intermix with episodes of depression. These disorders are much less common than unipolar depression. They may take the form of bipolar 1 or bipolar 2. The mania level symptoms in bipolar 1 is greater than that of bipolar 2. So the DSM-5 lists two major categories of mood disorders. People with depressive disorders experience only episodes of depression. People with bipolar disorder experiences episodes of mania, which are most intercepted with episodes of depression. There are several specific types of depressive disorders in the DSM-5. Major depressive disorder is diagnosed if a person has experienced at least one episode of major depression without any periods of mania. Persistent depressive disorder, known as dysthymia, is a less severe chronic form of depression in which the person has become depressed for at least 2 years without a major depressive episode. A person who has experienced at least one manic episode would receive a diagnosis of bipolar 1 disorder, regardless of whether he or she has ever had an episode of depression. One episode of major depression combined with evidence of at least one period of hypomania could qualify for a diagnosis of bipolar 2. Hypomania is a decreased level of mania. Studies have found that the lifetime risk for a major depressive episode is approximately 16%, and the lifetime risk for the persistent depressive disorder is approximately 3%. Rates for both of these disorders are 2 or 3 times higher among women than that of men. The lifetime risk for bipolar 1 and 2 disorders combined is close to 4%. The causes of mood disorders can be traced to a combination effect of social, psychological, and biological factors. Social factors include primarily the influence of stressful life events, especially severe losses that are associated with significant people or significant roles. Cognitive theories are primarily concerned with the way in which depressed people experience a severe event. Interpersonal theories focus on ways in which individuals respond to people and events in their environments. Depressed people behave in ways that have a negative impact on other people. In this way, they contribute to a stressful nature of their social environment. Twin studies indicate that genetic factor plays an important role in both depressive and bipolar disorders. They also indicate that genetic factors may play a stronger role in the development of bipolar rather than depressive disorders. Genes may contribute to the development of depression directly through an effect on the central nervous system and indirectly by influencing the person's sensitivity to environmental events such as severe stress. Neurochemical messengers in the brain also play a role in the regulation of mood and the development of mood disorders. Current thinking is focused on the serotonin and dopamine, although many other neurotransmitter substances may also be involved in depression. Several types of psychological and biological treatments have been shown to be effective for mood disorders. Two types of psychotherapy, cognitive therapy, and interpersonal therapy are beneficial for depressive and dysthymic patients. 3 types of antidepressant medications are also useful in the treatment of major depressive disorder. These include SSRIs, TCAs, and MAOIs. Medication and psychotherapy are frequently used together. Outcome studies do not consistently favor either psychological or psychopharmaceutical treatment. 3 other types of biological treatments are beneficial for specific types of mood disorders. Lithium and other anticonvulsant drugs are useful for patients with bipolar disorders. Electroconvulsive therapy has been shown to be effective in the treatment for certain depressive patients, and it may be especially useful for patients who are severely suicidal or have failed to respond to either treatment forms. Light therapy seems to be effective for managing seasonal affective disorders. People take one's own life for many different reasons. Most people who kill themselves are suffering from some form of mental disorder, such as depression, substance abuse, or schizophrenia. For some people, suicide represents an escape from unbearable negative emotions, which are often associated with social isolation and the perception of being a burden to others. The distinction between severe depression and the ups and downs of everyday life provides an important guide to the need for treatment. If you have been seriously depressed for several weeks, and if the depression is interfering with your daily ability to function, you should seek professional help. The first step in getting help is to find someone with whom you can talk. This might be a family physician, someone at your school's counseling center, or a therapist in a private practice. It is important that you feel comfortable with the person you choose and with the form of treatment that he or she will provide. Depression is not uncommon, but people who are depressed often feel lonely and alienated. Family and friends of depressed people find themselves in a very difficult and challenging situation. Mood disorders interfere with the person's ability to get along with other people and deplete his or her energy and motivation for seeking treatment. If the person doesn't follow through with therapy or make noticeable improvements after several sessions, friends can easily become discouraged or frustrated. Don't feel guilty if your efforts appear to go unrewarded. And don't blame the depressed person if he or she doesn't get better right away. Mood disorders are serious problems that require professional help. More detailed advice for families and friends can be found in the following resources.